Hello, my name is Diego Tavares, and in this doing report we introduce the article title Pathology of COPD. This article was published in the journal Critical Care Neuroscience Quarterly, volume 44, then 2021, in was written by Jennifer Lip and college. The article focuses on the physiopathology of chronic obstructive pulmonary disease of COPD that explains the key physiological mechanisms that I follow obstructions should inflammation oxidates stress and this remodeling in adds this could role embryonic factors in genetic cause like alpha amphitrions deficiency.
Objective. The article set dot analysis and or described the pathogens mechanisms that generate functional alteraction in the lungs producing COPD disease, as well as explain other significant factors that affect the development of chronic obstructive pulmonary disease.
Dr. Jennifer is a pulmonologist in Jefferson Hills, Pennsylvania. She has experience treating sleep apnea, chronic kidney dyspnea, and asthma, among other conditions. Tarek Shikman. He is a remembered social innovator and philanthropist, science, shifting his career from surgery to philanthropy in 1997. Dr. Shikman has had an exceptionally diverse career as a senior executive, advisor, and not executive director, both in the corporate and non-profit sector. Dr. Marvin R. Ballan is a pulmonologist in Pittsburgh, Pennsylvania, with experience treating heart dyspnea, asthma, and bronchitis, among other conditions.
The relationship to the subject matter of the article Pathology focus on explaining in detail the pathology physical mechanisms that cause and perpetuate chronic obstructive pulmonary disease. Content is fundamental to understanding how and when airflow obstructions occur in patients with cough. The chronic inflammatory response of cigarette smoke and other inhaled toxins, the role of environment and genetic factors such as antiphysine deficiency, the structural and functional alterations of the lungs, chronic bronchitis, emphysema, airway remodeling, systematic manifestation and association confirmation, the importance of recognizing observation and the physical impact. In other words, this article directly answers the query about the process that explains the development, progression, and clinical consequence of cough, which is essential physical therapy.
Chronic obstructive pulmonary disease (COPD) is a disease characterized by pulmonary inflammation and poorly reversible airflow obstruction. Although smoking is the most common cause in the United States, environmental pollutants and genetic factors also play a role. The pathophysiological chronic inflammation with increased neutrophils, macrophages, anti-lymphocytes, and pro-inflammatory factors. Chronic bronchitis characterized by mucus hypersecretion and gloved cell metaplasia emphysema. Destruction of the alveolar walls with the loss of the lung elasticity. Small airway diseases main side of airflow obstructive. Alpha-1 antitrypsin AAT and 1 and 2% of COPD patients result for mutations in the SERPINA1 gene, causing low levels of this protective protein neutrophils. Additionally, COPD is associated with the systematic inflammation that contributes to comorbidities such osteoporosis, cardiovascular and disease, lung cancer. Early diagnostic, especially of AAT, Deficiency allows for the lifestyles, modification and specific therapies to slow dashes, progression, retain time cloud, put committed errors, verify.
The article relates to physiotherapy treat men being in hinting the importance of evaluation and education of patients with coughs. Physical activities don't improve symptoms and stain, help lung function and quality of life. In patients what are pulmonary function tests, evaluation of dyspnea and evaluation of exercise capacity when performing physical activities, breathing techniques, and muscle. The new perspective we had obtained on the subject are: we had expanded our knowledge regarding the cause and factors that influence a person to develop this COPD disease and the allows on the understand the lifestyle habits of patients can impact their health in the positive or negative way.
Well, talking about equations, one of the questions is how does the protease-antipropase imbalance contribute to emphysema in the COPD? And the conclusion we can get: in the COPD, the genetic factors and environment exposures contribute to disease susceptibility, while the systemic inflammation drives comorbidities like cardiovascular disease and the osteoporosis. And the early diagnosis or smoking cessations are crucial for managing this heterogeneous disease. Through further research into personalized treatments is needed to address its diverse manifestations.
To create this map, the article was read, and below on it is the main ideas for the creation were identified. Below on this, I will submerging in the main ideas for the article below. Definition, causes, the physiopathologic mechanisms, inflammatory mechanisms, and oxygen mucus hypersecretion, and the chronic bronchitis, and the flow structure, emphysema, pulmonary vascular change, environment and genetic cause, artery deficiency, system inflammatory, COPD exacerbation. Based in these same ideas, I expanded to the information and understand the ideas, generating a good structure of the map. My name is Miguel. This is my part of the reading report was created.
Yeah. Hey, what a thing, what a friend came from, my friend,
Oh, yeah?
Oh, yeah, speaking of what a place and times, and drinks and greens and grind and grind.
Really?
Oh, yeah.
Oh, very nice, very nice.
Yeah.
Yeah.
This is the boat.